Do you frequently feel swollen, painful lumps in your groin, neck, or under your arms? Kind of like a really bad pimple that's deep and tender. What if you suddenly get a high fever, shaking, and feel so weak you can't get out of bed? These may be signs of a very old but dangerous illness called the bubonic or septicemic plague. Sounds scary, like something from a history book. Yes, it caused the Black Death in the 1300s, but it still pops up today, though it's rare. The good news, if caught early, it's treatable. So let's learn what it is and how to stay safe. What causes this plague? It is not magic or bad air. It is a tiny germ called Yersinia pestis. Think of it like a sneaky invader that usually lives in rodents, like rats or squirrels. Fleas bite these infected animals, pick up the bacteria, and then jump to humans. It is like the flea is a tiny syringe passing the germs. Have you ever camped or lived somewhere with lots of wild rodents? Then you might be at slightly higher risk, though it is still very unlikely. Septicemic plague happens when the bacteria multiply in the blood, while bubonic starts in the lymph nodes. Different starting points, same enemy. Imagine waking up with a fever like the flu, but then you notice a golf ball-sized lump in your armpit that hurts when touched. That's a bubo, and it's the key sign of bubonic plague. You may also shiver, throw up, or feel dizzy. Now, what if instead you feel sudden belly pain, your skin starts turning black in spots, especially on fingers or toes, and you become confused? That could be septicemic plague, when the bacteria race through your blood. No lumps, but way more dangerous. Both types hit fast, within days of a flea bite. If you've been hiking in rural areas or areas with wild rodents and feel this way, tell a doctor right away. How do doctors find out? They ask about your recent trips, animal contact, or flea bites. Then they take samples, like from the swollen lump with a needle, blood, or even sputum if you're coughing. Lab tests check for Yersinia pestis. It's like detective work, tracking the germ. Treatment, strong antibiotics, like streptomycin or doxycycline, given quickly. Think of antibiotics as germ destroyers. For septicemic cases, you may need hospital care, IV fluids, oxygen, even intensive care. The faster you get help, the better your chance. Delayed treatment can be deadly, so don't wait to feel a bit better. Can you prevent it? Yes. Avoid dead or sick rodents. Don't touch them, even if you're curious. Use insect repellent when camping. It keeps fleas away. Keep your pets from hunting rodents and use flea treatments on them. Yes, your dog or cat can bring fleas home. In plague-prone areas, like parts of the southwestern US, stay on trails and don't sleep on the ground. It's like wearing a seatbelt, just a smart habit. Also, if there's a rodent problem near your home, call pest control. Simple steps, big protection. Scientists aren't ignoring this old disease. Recently, they've been working on faster tests, like a dipstick test that can detect plague bacteria in minutes, not days. It's like a pregnancy test, but for plague. They're also studying plague vaccines. No approved vaccine exists for the public yet, but researchers are testing new ones, especially for high-risk workers, like biologists in plague zones. Plus, tracking systems use data from animals to predict outbreaks, like weather alerts for disease. So, while rare, science is staying one step ahead.